As I mentioned, Dr. Bryan Bohman began the journey in Stanford to physician wellness and peer support programs several years ago. Bryan, what prompted you to recognize the need for a peer support program?
Well, as you mentioned, I was chief of staff at Stanford when we started the wellness committee at Stanford. And I think that my mindset was probably affected by an incident that had happened just a few years previously to me, which I thought I would relate to the viewers because I think that it illustrates sort of what we're talking about when we talk about these sorts of critical incidents that are helped by peer support. I was mid-career in my anesthesia career and probably 15 years of doing anesthesia and was doing a routine orthopedic case one day, and suddenly my patient was dead in the operating room, pulseless, no EKG tracing, huge resuscitation effort, no success. And the aftermath of that experience for me, even a pretty confident, experienced clinician with a lot of support in general in my life, was really difficult. When the patient left the operating room was taped off with yellow tape so that, you know, the investigators could come later. I'm racking my mind, you know, what went wrong? What did I do? Did this patient have hypotension that I didn't notice? Did I miss an arrhythmia? I didn't know the answers to any of those questions. And they were downloading the data from the monitors. It felt like I'd committed a crime. And the risk management people, because they're right about this at that time, said, you can't talk to anybody about this, it's discoverable. So I felt very isolated. I didn't feel a lot of support, even though people were nice to me, it didn't feel that way. And you know, I didn't know that what was missing. I didn't know about peer support programs at the time, but you know, that was a very powerful experience for me. And so later, when I was chief of staff, the whole idea of wellness for the medical staff was something that hadn't really been high on people's minds at Stanford. We didn't have a wellness committee. But as chief of staff, I saw a lot of results of the pressures that are more and more on physicians in practice in all of our organizations, I think. Just increasing emphasis on productivity, on how are you doing on your quality metrics? How are you doing on your patient satisfaction? How are you doing on your professionalism? All of which is really important and very valid, but what I was seeing is people coming into my office who were sort of being pushed off the edge of a cliff occasionally. And we had at our institution a pretty good program for helping physicians who were in really severe distress. But what we didn't have is anything that would sort of address folks before they got to that point and would help them to cope with sort of the everyday increasing pressures that I think that clinicians are experiencing across the country. And so we started the Wellness Committee, and we started thinking about how do we address the issues that we formed to address. And one of the things we decided is that we really needed to do a survey because being in an academic institution, data speaks. Opinions, anecdotal evidence isn't so compelling. And so we decided to do a survey of our medical staff to see what was going on. These data are not from our medical staff. They just show the prevalence of burnout among physicians nationwide. And you can see there's some variability between specialties, but really the burnout rates between above 30% to above 50% have to be considered unacceptable by any reasonable person in a profession like medicine where folks are selected for being fairly resilient, capable of a lot of hard work. And so we thought we would see how we were doing at Stanford. But what we wanted to do is not focus just on burnout. We wanted to think about professional fulfillment, sort of the flip side of burnout. We want to know how people were doing in their careers in general, look at the positive as well as the negative. We define fulfillment as satisfaction or happiness as a result of fully developing one's abilities or character. And our hypothesis as a committee and the way that we present ourselves to the organization is we believe that physicians who have high professional fulfillment will give better care, will have better quality outcomes, will produce better results for the patients and for the organization. Our results were 25% of our physicians were burned out. That's lower than national averages, but luckily nobody in our institution said, oh, well, that's okay. 25% is not bad. 23% had high professional fulfillment, and we'd like to see that number very, very much higher as well. And then what we found in our survey was what was it that determined this high level of professional fulfillment? And what it was perceived appreciation and peer support. And those are the numbers that on this slide that show the amount of the effect. You can see that appreciation was a little bit larger than peer support. But what our committee thought is that you really can't show appreciation if you aren't supporting people, and especially in these incidents such as the one I described where we're sort of leaving our wounded on the field without support. And in order to develop a culture of support in our organization, we felt we needed to do something about that. Why do you do peer support after clinical events? As I just related and as studies have shown, there's a lot of distress after these events. It affects folks emotionally, it affects them in their personal lives, it affects them professionally, and people do not currently feel supported. And I think that there's a lot of evidence also that it puts their subsequent patients at risk, and it puts the physician at risk for burnout at a higher rate than even the high rates that we already have. So we decided in our wellness committee that this was the first intervention that we should do in our organization. I think Joe's going to get into this a little more later, but one of the things that we thought is that we really need as an organization to address the historical medical culture of the physician as some sort of superhuman who is personally responsible for everything about patient outcomes, that, you know, if only the physician is perfect, the outcome will be good. It may have been true in some sense 75 years ago. In today's team-based, really hyper-complex care, this is just an outmoded attitude, and we need to get over it as a profession. The idea of physician, heal thyself. Culturally, we are taught that we shouldn't take time to take care of ourselves. And most of us have ingrained that in our own personalities, and we really don't have the inclination to do that. We feel that it's a sign of weakness. So in 2013, with this sort of thinking behind us, we decided on our committee to look at peer support. We looked nationally to find out who's doing this. How do we do this? What would we do if we were going to have a peer support program? And we didn't find much until we stumbled onto Joe's program at Brigham and Women's Hospital. And it was clear that Joe had a program that was working, that had been well thought out, that had there was something that really we could relate to as an organization. It was at a peer academic institution. And we decided that that was what we would like to model ourselves after.